It's my very great pleasure to introduce Dr. Heather Wood-Ion, who has the most fabulous name for a gathering, an occasion like this. She is a cultural anthropologist, and the title of her speech is Creating an Epidemic of Health, which is a very interesting connotation. And one of her other specialties is that she deals specifically with organizational troubles. So please welcome Dr. Heather Wood-Ion.
Thank you very much for being brave enough to listen to someone who wants to start an epidemic. When I tell you that my heart belongs to Calcutta, you should be truly afraid. Jonas Salk said that it is possible to create an epidemic of health. He also asked, are we being good ancestors? But his focus was on this. His focus was, does every choice we make, how will every choice we make influence the children of our children? He said that each encounter evokes potential from every participant. Each environment evokes new possibilities within the dynamics of each encounter. So that implies not only are we interdependent, but we have mutual responsibility, classic mutual aid. And we have a huge tradition in this country of mutual benefit, mutual aid organizations in community development. Again, each person is going to benefit and grow as they take responsibility for the other person's growth. In the contagion of health, we know that experience is contagious, emotions are contagious. Tom referenced James Fowler, the contagion of happiness and the amplification of emotions through social connection. We know that wisdom is shared through stories and passed down through stories. We value health only after we are exposed to it. So consider yourselves exposed. We can think of all sorts of negative epidemics. The most important point about an epidemic, and the fact that gives us confidence and faith that we can create an epidemic of health, is that a spread of an epidemic does not depend on a leader, does not depend on an institution. It depends on networks and relationships. And vectors of epidemics are many in multiple relationships. Our standard expectation is that health is the absence of disease, which means if you aim low enough, you will inevitably crash. The World Health Organization defines health as physical, mental, spiritual, social, economic, and environmental well-being, or, my favorite word, vitality. Health does not depend on policy. It does not depend on providers. It depends on each of us. What would an epidemic of health do? It would identify and amplify what's working. It would engage existing networks. It would expand social learning. For instance, oral rehydration therapy has expanded across networks of women to save children's lives. And it would explore and experiment with the potentials of our world. Why is an epidemic of health absolutely critical now? Why is it our joint and singular responsibility? Because over the last 200 years, the increases in longevity in our lifespan have been due to sanitation, improved water quality, improved nutrition, improved knowledge and choice, not medical care. And as the burden of disease has decreased because of all these public efforts, such as vaccines and so on, the costs of medical care have skyrocketed and life satisfaction has diminished so that, and this is an emergency issue, depression is now a worldwide leading cause of death and is the second leading cause of disability. We can't afford the epidemic of depression that's going on right now. It's a terrible legacy to leave to our children. So how do we identify what indicates vitality and health in our neighborhoods, in our families, in community? Dr. Gary Gunderson down in Memphis has come up with 5 leading causes of life instead of the leading causes of death. And he says the leading causes of life are connection, coherence, a sense of meaning in life, a sense of agency, of being able to be responsible for and act on our own behalf. Bridging or blessing. As we pay it forward toward the future, we are grateful for what we have inherited from the past. And hope. We can imagine a better life for ourselves. We can imagine a better life for our children. Just as imagination constructs our memory, so imagination gives us hope. So let us think about the way forward in creating an epidemic of health. We actually know how to do this. We've actually built this nation on mutual aid and mutual help. And as Mike Myers once said, no money fun. So we have the lessons from disaster care, we have the lessons from our pioneer forefathers, and we have amplifying what works to evoke wonder, or as David Brin referred, we have resilience. All of the lessons in those 3 things tell us how to move forward. One of the relief workers who was down in Haiti immediately after the earthquake rang up from England to ask the Haitians he had helped how things were going. And the reply was, the natives are thriving, the disaster care workers are drinking too much. The lesson from our pioneer forefathers is every one of us can do more than we think we can. And the lesson from resilience is we must work to evoke wonder, because once we can wonder and feel awe, we can aspire to a different way of being. This is one of my favorite groups of children. They are from Bangladesh. They are street children. They have no homes, no parents. And as you can see, they're mischievous. They're ready to take on the world. They're full of vitality. They do not think of themselves as deprived. When I contacted the man who looks after them after the latest cyclone, which of course was advertised here as a disaster, he replied and said, remember that for us that's normal. These children do not grow into vitality because they think they live in a disaster zone. We put that label upon them. What do we know from disaster care and mutual aid and mutual benefit? We know that in disasters, what happens is improvisational. And this is not disaster management by professionals. This is neighbor helping neighbor. And if you don't know your neighbors now, get to know them, because the study of disasters shows that most lives are saved by neighbors, not by professionals. So we know it's improvisational, it's adaptive, that it depends upon local knowledge, depends upon local competence. It's cooperative in the identification of resources. And this is a very important point, it is based on the apprenticeship model of the transfer of skills. Tom referred to Alcoholics Anonymous. More importantly, our pioneers taught us how to deal with adaptation. The apprenticeship model is critical. It enhances self-reliance, the sense of agency, and the solidarity increases meaning. Never asks permission. Good disaster care does not ask permission. What do we know from the pioneers? We know, again, similarly, it's improvisational and adaptive, relies on local knowledge, not external experts, there are none. It's cooperative in the creation of resources. It relies on the apprenticeship model of skills transfer. It enhances self-reliance and agency. There is a coherence of meaning through creativity, and it's driven by need and imagination. All of us can use these thoughts: improvisation, don't ask permission, just do it. Find out how to teach someone something. If you have a skill, who are you teaching it to? That builds our resilience, it builds our ability to feel vital in this world. This is the basis of the apprenticeship model. teaching a skill. Here's a father teaching children to blow bubbles. We are losing this apprenticeship model in our society, and it is critical to our sense of vitality. Resilience. The core understanding of resilience is that your experience does not define you. You have a choice in how you respond to resilience. So you are not just a victim of disaster. You are not an earthquake survivor. You can choose how you respond. Exploration and experiment build competence. David Ellerman has a wonderful phrase about parallel experimentation. This is key in vitality. If you don't know what gives you the feeling of health, you can experiment and find out something else. In resilience, we discover our meaning through roles and relations. Again, the apprenticeship model or mentors. We affirm our self-worth through shared action. It's very interesting in our society. We think of homeowners associations as enemies, not as cultivating neighborhoods and vitality. And that's very sad, but it's very critical that we change that in order to have communal and social vitality. And the final point about resilience, and this is also true in disaster care, it's also true of our pioneers, is that they celebrate connection and beauty. We used to have harvest festivals. There used to be huge communal celebrations of joint achievement. The loss of those is a loss of resilience and a loss of vitality. Don't let the celebrations of your life and your family be commercialized. It's terribly important that we affirm each other by celebrating each other's health and potential. So here are some of the examples of what's going on in the world in terms of starting an epidemic of health. Down in Memphis, the Congregational Health Network is established in a region of terrible urban disparity. They're doing wonderful things in encouraging vitality through the existing network of churches. The United Health Centers of the San Joaquin Valley have an amazing approach using the World Health Organization definition of health to improve the health of migrant and displaced workers. Migrant and displaced workers all over the world are a very significant population. The Imagine movement is now in 32 countries. It was started in Chicago to improve the urban atmosphere and help people to imagine a better way of life and then decide on the shared actions to create that better way of life. And Wisdom Legacy at wisdomlegacy.org is archiving the lessons learned from experience. It's publishing its 4th book on the lessons learned in behavioral and mental health care. And you can go on the website and begin to archive your own lessons learned, should you want. All of these are examples of the cultivation of an epidemic of health. In disasters or in problematic communities, you will always find symbols of health and vitality. These are the handprints up in Julian of the children after the fires, the last set of fires. And the title on the top of that wonderful mural is Our Firestorm Friends. Our Firestorm Friends. And the children who were evacuated here to the Delmar sports ground and fairground said it was the most meaningful period of their lives because every action they took gave them a sense of being, a sense of belonging, a sense of value in their community. Wisdom is not scarce in the world. We have not sought to find it. It's out there. We need to seek it for vitality. This is a group of kids over in Albuquerque who published their first book of Wisdom Legacy by going out into their neighborhoods and interviewing heroes. And you can see they're celebrating their accomplishment. So, I have co-opted each of you. to be a vector of health. a vector of vitality. You've now been exposed by my little angels to the epidemic of health. How do we begin? Each of us must begin by asking these serious questions, and then asking the questions in our families, in our neighborhoods, as far as we can go. With colleagues, it's great fun to ask these questions in the workplace. What makes your heart leap? What nurtures you? Or who do you nurture? Or what do you nurture? Describe a time when you felt fully alive and vital. Who shared that experience? What of that experience would you like to pass on to the future? And next, what evokes your wonder? What evokes your play? Tell someone your own story. Talk about 5 moments of great joy. What adventure would you still like to explore? The children are trying to free a butterfly, and their faces are captured with wonder. If you ask these questions with full attentive listening, you will begin to know your own vitality, and you will begin to spread the epidemic of health. And it is within our reach, but it is critically necessary because that. Thank you.